here, don't forget to give the video a thumbs up on your way in or out or whatever you feel like doing. So, where am I going here? Ah, okay. So, this has been an interesting year for me dealing with the medical system, right? The healthcare system. At it, but not as the patient, as a caregiver, right? And what I discovered, well, I, our healthcare system is on shaky ground. And I don't think that we are fully grasping that. I don't think we are fully grasping that. So what do I mean specifically? I'm talking about the plight of nurses in the US, and not just in the US. By the way, Canada is having a time with nurses leaving the profession in droves. So I mean, I mean, it seems to be, I won't say an exclusively a Western problem, but it definitely appears to be a North American problem because Canada's having problems, and the U.S. is having problems too, retaining nurses and making sure that the medical environments are safe not only for patients but for nurses as well. You guys, without nurses, the medical system don't run. You think these doctors could do fuck all without nurses? No, they could not, right? How do you think we would be as patients without nurses? Effed in the A, and not in the fun way. So there was an action last week, Austin, Texas. Well, at the end of June, going into the first, part of July. And I want to pick up the story from Ford Sanders, a TikToker whose video I was able to locate because I was looking for something else entirely, and I wasn't even aware that this strike action had taken place. So let me give you a little bit of a primer here. Late last year, I think it was actually back in September, in Austin, Texas, the nurses at Ascension Seton Medical Center voted to unionize. 1 month ago, back in June, these nurses overwhelmingly voted in favor of a strike action. And in late June, they agreed to do a 1 day strike to bring attention to the patient to nurses staffing ratios, of which the nurses say help to foster unsafe conditions, the lack of adequate breaks that these nurses get to take, and a host of other issues. So let's take a look at the TikTok from Ford Sanders, who was on the scene at out in front of Ascension Seton Medical Center there in Austin, Texas, as the nurses were going through their 1 day strike action. And after we come back from looking at this, you guys, there was a bit of a plot twist. It was a bit of a plot twist. But let's take a look at their 1 day strike down there in Austin.
Nurses with Ascension Seton here in Austin, Texas are officially on strike. I want to go ahead and show you what's going on right now. You guys can see all of these nurses lined up and down the streets here off of 38th Street in Austin, Texas, right outside of Ascension Seton Medical Center. They are demanding safe staffing. They are demanding a union contract. They're demanding the board to approve on that union contract and bargain in good faith. One of the big things here is these nurses said that they authorized a strike just for June 27th, which is today, but Ascension responded saying they're disappointed and they're actually going to not allow these nurses to return to work until July 1st. A lot of these nurses tell me that that is irresponsible due to the fact that they are only on a 1 day strike to make sure that their patients are okay, but now Ascension is adding an extra 3 to 4 days and not allowing them to come back. They say they're actually going to show up tomorrow in their scrubs and be ready for their shift. But you can see all of these nurses right here, community supporting, and today they are on strike.
Love to see it. You guys know that we love the strike actions and the protest scenes. We love these things. We love for especially workers to assert their rights. Hey, somebody ran us some money. Wait a minute. Skirt. And the nurses said the nurses want better conditions. I don't even think that this is necessarily a money issue. Oh, Fraudy Oh, Freddie French, thank you. Oh, thank you so much for that, Freddie French. We love you. You know we love Freddie French around here, even though she's in, she's in under pseudonyms and shit. TW Alves, that's cool. Freddie Francais. Somebody call him Crazy Joe. Somebody call him Batman. Nah, that's the wrong quote. Anyway, my my bad. Let me get refocused. So this 1 day strike action there. I June 27th was the day that the nurses voted to strike, and you heard the TikToker there, reporter. They call a man a reporter. He reporting and shit. You heard the reporter there say that the hospital said no. Your 1 day strike actually is sounds like it's basically an unpaid suspension, that the hospital would not allow these nurses to return back to work, back to their shifts for an additional 3 to 4 days until July 1st. And I said, surely they didn't do that. I said, surely that did not happen. Guys, that absolutely fucking happened. Look at this package from a local media, pardon me, local TV news outlet there in Austin. Let's take a look.
As the sun rose Saturday morning, some Ascension Seton nurses returned back to work.
We had our strike on Tuesday. The community support was amazing. We were so thrilled. It felt very powerful.
Nurses flooded the streets in front of Ascension Seton Tuesday to bargain for contracts that would alleviate staffing shortages. The demonstration was the largest nurses' strike in Texas's history, the union says. Ascension hired temporary nurses to fill gaps during the strike. The hospital said it did not allow striking nurses to return until Saturday because of the required length of the contract for the temporary staff. So when nurses tried to return to work Wednesday after the 1 day strike, security guards met them at the door, telling them they could not return for 3 more days.
We just wish they hadn't chosen to lock us out.
Christine Kittleson is a nurse who works with new moms and their babies. She was also at the strike on Tuesday.
We're spread too thin, and we're not able to provide the care that we've promised people and that we're here to give them. And that's why we came into this profession, to feel like really empowered after the strike and really empowered together. And we're feeling stronger than ever, so we're ready to continue on and get this contract settled.
Ascension sent us a statement calling the strike disheartening, but that they will continue to negotiate in good faith until they can come to a mutually beneficial agreement that respects the human dignity and rights of all. Crittenden said that while the lockout was frustrating, the conversations that have taken place over the last week have been encouraging.
So it's been very rewarding to be able to have that communication with folks.
Sam Stark, KXAN News.
The hospital locked the RNs out of the hospital because they had retained contracts for temporary nurses to fill the day of the 1 day strike, but I guess the contracts had a minimum of 3 to 4 days. I mean, just the optics, just the optics. Even if it, I guess, loosely made sense from a corporate perspective, the optics of that look fucking terrible. Like, you're locking out nurses, seriously, just completely outrageous. So we've seen a lot of these. We've seen a lot of nurse strikes, a lot of healthcare worker strikes over the past couple of years. These actions have really ramped up since the pandemic, when nurses and the other so-called essential workers found out that no, they were actually not essential. They were very expendable. They will be on the front lines of a global pandemic, and their safety and considerations be damned. And rightfully so, a lot of people in that profession said, fuck that. I'm not fucking expendable, bitch. You know what's expendable? This fucking job. I quit this bitch. And between retirement ages, between nurses of a certain age heading towards retirement, leaving the profession, towards even younger nurses who experience a wide range of working conditions, literally from coast to coast. I was on Nurse Talk, on Nurse TikTok, and the girlies was breaking it down. They were saying, California has some of the better nursing protections for to help prevent against nurse burnout. They are given frequent breaks. They have very strict patient to nurse ratios, and that this can also vary between unionized hospitals and non-unionized hospitals. I saw a number of nurses on Nurse Talk complaining about nurses unions. I saw other nurses, you know, gushing over nurses unions. So I mean, either way, this is what we're realizing, and this is what these nurses as workers themselves are realizing, that they are not here to be burned out. They are not here to be sacrificed on the front lines of the next pandemic, which by the way, I'm seeing the news stories, the propaganda pieces starting to pop up in July about the coming triple demic this fall and winter. The triple demic of influenza, COVID, and RSV. They're already anticipating big surges in people being sick. I'm seeing anecdotally, nothing that I can prove scientifically, but anecdotally, I'm seeing on social media, there's new COVID strains, floating around that mimic pneumonia potentially. Like, there's just shit happening here that we're going to need nurses for. Okay. And the nurses are getting burnt out. The nurses are getting fed the fuck up. And should the nurses exit, should we reach a critical mass of nurse exodus from the profession, our healthcare system is fucked. And it's not just going to be the emergency care, the acute care, critical care aspect of the shit that's going to be fucked. You're going to be fucked trying to go get a colonoscopy. You're going to be fucked trying to get a lumpectomy. You're going to be fucked trying to get kidney stone, gallbladder. I mean, stuff that is so-called routine procedures are going to be harder to schedule, harder to obtain. People are going to end up not being able to get these procedures and surgeries, relatively minor surgeries, done because you're not going to have the staffing for it. It's just not going to be there. Is America doing anything to shore this up? Absolutely not. And it's just another example of the institutions of this country literally crumbling in front of us. And it sucks for all of us, but it particularly sucks for those who are chronically ill, for those who are disabled, for those who are elderly, for those who are headed towards being elderly. I'm shook. Okay, I'm shook the fuck up. What's all this going to look like in 15, 20 years? Madness. That's what it's going to look like. It's going to look fucking crazy. So we want to send solidarity to the nurses. Now, let me repeat something that I had touched on Tuesday, but because the stream got cut off, maybe some of this got cut off. But Will, if you could throw up that tweet, I believe it's from the Washington Business Journal. It's been reported that the nurses at the George Washington University Hospital here in Washington, D.C., have voted to form a union. They will be allied with the DCNA, the DC Nurses Association. So what this does, it opens the door for contract negotiations with their employer at the Foggy Bottom Hospital. Who was the employer? I believe it's Universal Health Systems or Universal Hospital Systems. If you could pop up, yes. Some of the complaints from the GW hospital nurses, it all echoes the same thing. It's patient safety, it's being overworked. And I was listening to a nurse who represents, I believe, a Texas Nurses Association. And one of the things she mentioned that I hadn't even thought about that nurses encounter is the amount of workplace violence that happens in hospitals and in medical settings. And when she said that, I said, that makes perfect sense, to be honest. First of all, hospitals are high stress areas, right? Like, who the fuck is having fun at the hospital? Nobody. Patient, nurse, doctor, guest, no one's enjoying the hospital, right? The hospital is a high stress situation. So I can understand that people's emotions run really high. I mean, shit. I mean, I didn't get violent at the hospital, but they act like they was playing some games, getting my mama her pain medication, and I had to raise my voice a little bit. You know what I'm saying? Security did come around, but the security was a bruv, so and he wasn't no coon ass, so he didn't put me out. Thank you, bruv, for that, for allowing me to remain at my mother's bedside. But I did have to get loud with them people and tell them about themselves. But that's neither here nor there. Hold on. But I was not violent. I just got loud, right? I'm talking about actual workplace violence that nurses in particular sustain on the job. And what clicked to me was, I mean, how gendered a profession nursing is, right? Of course there are male nurses, no, without a doubt, but there are way more nurses who are women than there are men who are women. And violence against women is sanctioned. It's sanctioned in America. I mean, shit. When you listen to the flight attendants and the flight stewards talk about, we see the viral videos showing people attacking stewardesses all the time. I would imagine in gendered professions, or professions where the gender representation is very lopsided, female heavy, women heavy. It would, yeah, that does, when they said that, when I heard this nurse from this nurses association say that, I'm like, I hadn't thought about that, but yeah, that makes perfect sense. So this profession is under duress, it is under attack. It is a casualty of corporate greed and corporate exploitation. Also, the further expansion of the criminalization of abortion is also driving medical professionals out of the field. Our healthcare, I can't say it's under attack, because I mean, if you never had it, then you were always under attack, right? If you never even had access to quality healthcare, then you've already experienced quite a violence from this institution. But if you ever had any expectation of receiving medical care, you should probably start lowering those expectations. You should probably start lowering those expectations, because if we don't assist nurses, if we don't stand with nurses and other medical staff against the greed of these healthcare companies, against the greed of these hospitals, there's going to be nobody there. Like, should you have to call 911 to be taken to the emergency room? Who's going to be there to treat you? Who's going to be there to assist you? A lot of people who are going to be inexperienced, not properly qualified for the rigors and traumas of, let's say, ER nursing. If you see or have any opportunities to stand in unison or stand in solidarity with nurses, take the moment to do so. Congratulations to the nurses at George Washington University Hospital for their vote. I want to send solidarity to the nurses in Austin at the Ascension Seton Medical Center for their principled stand in action. And we need to be paying attention to this, and we need to learn basic CPR, first aid, and basic triage yourself, because should some shit go down and ain't no nurses available, we got to keep us safe. So there's that.